Would you ever drop your kids off at a public pool knowing there was no lifeguard on duty? No, then why do you drop off your kids at the football, soccer, and baseball fields without the knowledge that someone could take care of them if they got injured? Injury rates in youth sports are rising. Every 25 seconds, a young athlete suffers a sports injury severe enough to go to the ER. 44% of injuries are to players under age 15. Almost half of youth sports-related concussions occur in children ages 12 to 15 years old. And according to the CDC, more than half of all sports injuries in children are preventable. Sadly, by age 13, 70% of kids drop out of youth sports. And youth sports injuries are a major health issue. What happens later in life after these sports injuries occur repetitively? Look carefully at the X-ray.
Good lick, Charlie. What's wrong with you? What happened? What happened?
Concussion rates for children under the age of 19 who play in football have doubled in the last decade, even though overall sports participation has declined. The chances of a youth football athlete suffering a concussion over the course of one season is 75%. Parents and coaches, was what you just witnessed okay? And does the coach, do you know what to do if and when this does happen? So mom and dad, you've entered your child's medical and emergency information into the league's online system when you registered your child. Great. Now, where is that information when your child is lying on the field injured? Is it immediately accessible to the person who runs out to care for your child? Does that person know what to do? Is that person properly trained? And even if they have been certified in CPR and have watched a 20-minute CDC video on concussion one time, do they really know what to do, especially in the stressful situation of an on-the-field emergency? How good are you at something you don't do every day? And how good are you if you're only trained for a few hours once every 1 to 2 years? I know I'm not very good. Who runs out to your child? Who calls 911? What do you tell the 911 operator? Who runs out to meet the ambulance? Who travels with the child in the ambulance? Who is caring for the rest of the children on the team? Who is attending to the people in the stands? The parents. In other words, does your child's sports league have an emergency action plan? Do they even know what that means? And even if they do, is it immediately accessible to the people who need to see it in real time? What if all medical and emergency data were available real time to coaches and parents? What if that emergency action plan was available real time? What if the what to do and how to do it information was available real time? What to do, how to do it in real time. Communication between coaches and parents, is it documented? What if location, games and practices and schedules were available to coaches and parents? And what if all that sports safety education and training was available anytime to coaches and parents all in one place, and completion of the training was documented? Which headline do you want in the paper after an emergency? Grigori High School student dies after collapsing in gym class. I want to know why they take so long to take him to the emergency room, the father said. I want to know if they performed CPR. Or Long Island soccer coach saves 7th grader's life. The young girl thanked her coach for saving her life and said she now wants to learn CPR. Game changers, safe kids worldwide. Coaches need to be educated and confident in making decisions that protect the long-term interests of young athletes. So once again, where is this information when the coach needs it most? When the child is lying on the field. Is that coach going to remember what they learned in that 1-hour clinic or video that they watched? And did most coaches even go to a clinic or watch a video? Parents markedly underestimate the risk factors associated with a specific sport their kids participate in. They mean well, but they do not understand the risk factors. Too many athletes end their careers not because they want to, but because they have to. Don't let this happen to your child.